Hey guys, welcome to Vet Ranch. I'm Dr. Karri, and I look tired because I am tired. It's been a long day, but we're here right now with a little dog that we're currently calling Baby Girl, but our foster's in the process of thinking of a better name because we feel like that is good luck to give them a forever name because they're going to make it. Baby Girl was surrendered. She was hit by a car probably over 24 hours ago, and I think she originally went to a vet and they diagnosed some possible fractures of her pelvis and hips, and then they went ahead and surrendered her to the shelter. And the Fort Worth shelter is awesome about networking, and so they urgently got a hold of us, and we urgently got a hold of Saving Hope, who urgently found a foster that also transported about 2 hours away. So here we are, and that all happened in a matter of, what, 3 hours? Pretty quick, pretty dang quick. So anyways, we've all come together, and we're gonna try to save this little one. Let me show you. So Baby Girl is got a pretty bad head injury, and that's frightening to look at, but we're most concerned about hip issues, broken pelvis. She seems like she's not too shocky. I just gave her some morphine, and they had given her some pretty good pain meds as well. But we're going to go ahead and put in an IV catheter and start giving her fluids, and then maintain her on obviously some antibiotics for that head wound. And then we need to get some radiographs of that back end and just figure out what's going on. That's my biggest concern is, you know, dogs can heal from lots of pelvic fractures, but it just depends on how severe it is and where the fractures are located. Are there other bones fractured? Other internal injuries, like is her bladder intact? Those are things that we're going to be looking for as we go through this process. One thing that's really important to note is that she does have sensation in her back legs and she can move them. So those are all super positive signs, because that's my initial concern every time I see these dogs. You okay, baby girl? So we're gonna get started right now and quit chatting and try to save this little one. We have our IV catheter in place. She's already had morphine. We've given her some Vaseline, which is an antibiotic, and then some Serenia to kind of counteract the nausea that the morphine can cause. And then we're just bolusing her some Head-a-Starch and some lactated ringer fluids just for her shock. And then we are about to gently move her over to x-ray and finally get some answers as far as what is going on with her and what's broken. So we're going to do that next. We are looking at Baby Girl's radiographs, and they are far worse than I could have imagined, unfortunately. Her pelvis is just completely, almost just removed off of her sacrum. So this is not attached anymore. This side is not attached anymore. It should be like this, where here's the sacrum and here's the wing of the ilius, and it is completely dislocated. So this right here should be here, okay? And the other side looks like it's dislocated as well. We have a fracture down here. This is fractured, so like this part is completely fractured off here. There's a fracture down here, which I'm not that concerned about. So it's really going to be tough. We need to consult with the orthopedic surgeon and see what can be done for her, if anything. Because these are really, really bad injuries, and there's no wonder why she can't walk or she screams anytime she tries to move or get up. So not good. You can see on the side when you can see that fracture really well like that. So this piece here should be right here. So that's fractured and moved, and then here's that little piece that's hanging low that was fractured. So I'm kind of bummed, but we'll see what we can do. Hopefully there's something that can be done. It's the second day, and she's not really moving around too much because she can't, but she seems to be more alert, and she's hungry, which is a good sign. You can see those kind of broken blood vessels in her eyes from the impact. So that's a good sign. She's got some will to live because she's at least eating and more responsive today. So we're just going to get a plan together for these hips, and hopefully there's something that can be done to help her feel better and regain function in her back end. I know. Is that good? You had a pill in there and you didn't even know, did you? Ha-ha. We are going to close this head wound now, one of many surgeries, just because now we have a surgical plan for her pelvis. So we're going to get this fixed up so it can start healing and it's nice and kind of clean. I'm going to debride some of this dead tissue off this area freshen these edges because they look like they're kind of starting to scar in, and then close it up, and hopefully it'll heal okay. It may dehiss, which means reopen because of, you know, infection or because it doesn't have good blood supply, but then we'll fix it again. We have freshened the edges, which means taking off the dead tissue, and you can see how it's bleeding and all of that kind of pale white tissue is gone, and that's what you want to see, because you want to know that, you know, when we suture this together, that it's going to heal because it's fresh tissue, not old tissue, because old dead tissue is never going to heal properly. So now we're going to go and close it up, and then I will show you when we're done. We are just putting the last couple sutures in, and then we're going to wake her up. And I guess this will say surgery 1 of 4 is complete. At least 2 pelvic ortho surgeries, then a spay sometime after that to get her adoptable, and then we will be done. It's a long road. We are at one of our favorite vet partners, Maisie's Mission, and Dr. Davidson, the amazing Dr. Davidson, is a surgeon that has agreed to attempt fixing our little baby girl with 2 separate surgeries. So we are so excited, and we are going to get her started right now. We have baby girl under anesthesia, and we're about to do her first surgery of 2. And so they're going to start prepping in a minute, and then we'll get going. We're done with the first surgery, and now she'll have another one in 24 hours. These are the 2 pin and a screw that has corrected the SI luxation and kind of put that back where it goes. And then tomorrow we're going to deal with the left side and then try to fix that again. So you can see those 2 screws going right through there. But everything went great. So we're waking her up right now. We are rechecking baby girl, and she looks pretty good. We'll show you her suture sites in just a second. I think we can remove her sutures. She's walking around pretty good, but she did have an ulcer that we found when she was having her second surgery, and you can kind of see this cloudiness on her eye, and then all that redness is new blood vessels there. Let me see if it helps you if I show you that. So you can see how it looks like there's a little white kind of cloudiness there. She's been on eye medication, eye drops for a while, but it's not really having a great effect so far. So we're going to do a little bit of a scraping. We have to put the camera down for some help holding, but she is sedated. And she also has a deadening drop on her eye, so she should not be able to feel her cornea at all. We're going to do a little scraping and hopefully culture whatever bacteria is living in there, so we can target that better to make sure that she heals. I don't know about you, if someone was coming at my eye with a blade, I would not be okay with it. They would have to sedate me for show. We are taking out her sutures from the head wound, which looks like it's healed great. It's got a couple big scabs there, but underneath it, it looks all healed up. You see your eye today? Can I see your eye today? Ooh, look at your head. Looks so good. Oh, your sutures are out. Can I see your eye today? Looks pretty good. Now she's getting her own serum dropped in her eye to help it heal. And then she's also getting 2 different types of antibiotics. So every few hours she's getting drops put in there. She's doing pretty good. Look how good she's walking. She could not even walk before surgery. Good girl. There you go. That tail works. Does your tail work? Good job. Look at you. It's like a week after surgery. It's pretty impressive. Tough girl. We are rechecking Zoey today. Look how good she walks. That's just amazing to me. And then why are you shaking your head? And then we are going to spay her as well because that has to be done before she can be adopted. And then we're going to x-ray her, look at her tail. We're going to x-ray her hips and her pelvis and see how that looks. I'm really interested to see kind of how those screws look and everything. Oh, that's a good girl. She is the best dog. That's a good girl. Are you ready? Today's a big day. Today's a big day. She's waking up from surgery now. We're waiting to pull the endotracheal tube and we took x-rays. So I am going to go and show you what her x-rays look like. And she is doing awesome. Let me show you her eye too. Her eye is all healed up. She had that really deep ulcer. So that looks good too. Here is the lateral view of baby girl, who we're calling Zoey now. And I'm just amazed. This is already starting to kind of heal together. Here's her plate. And then here is the other view. So you can see these 2 screws still look perfect in there. This is kind of collapsed, but it's starting to heal back together. This is still open, but starting to bridge. And then this also looks amazing. So this was in the 2 pieces, and now it looks completely healed. So just phenomenal success. And then we'll recheck her in 2 weeks, and then that'll be our last one. Zoey is transferring out to a rescue in Brooklyn, and I have no doubt like she'll get adopted immediately. So she's such a good girl. She's come so far. Initially, we didn't think her hip was going to. Her hips were going to be savable. Her pelvis was completely shattered, and you can't even tell she had that huge wound on her head initially. Her ulcers cleared up in her eye, and she's just such a happy girl. So now she's just full of zoomies, and she loves to play with other dogs. And so we are so thankful that, you know, we undertook the process of 2 painful surgeries because now she's just a perfect dog. So thank you guys so much for all your support, and thank you for allowing us to pull dogs like Zoey and put her through pretty expensive surgeries. Without you guys, we couldn't do that. So thank you guys so much, and we'll see you next time. Bye, Jojo. Bye. Oh, I can bit my nose. I can bit my nose.